Hello, good evening, everyone. Today we would like to present you a wonderful topic with wonderful doctor. Let me present our speaker for today. This is Dr. Inigo de Felipe, originally from Spain, graduated from Navarra University, but also completed his education in Harvard University. Now he's associated professor at Harvard at Navarra University, and he's completed his PhD at Navarra University. But mostly, of course, well-known speaker, international speaker who has been doing teaching worldwide, and very well-known speaker at majority of international conferences like IMCAS, Monaco, AMWC, and so on. So thank you so much, Inigo, for joining us today. You can start.
Thank you very much for your introduction. So thank you all of you for joining this webinar. I think it's very interesting because there are many products out there, and I've been trying many of them, and I have arrived to certain and different conclusions. So let me introduce the portfolio of products and also why they work and how they work on my patients. So let me share with you the presentation here, right? Let me see if I can do this like this. All right. So Cellbooster is a collection of 4 different products for different indications. The first product is the Cellbooster Glow, which basically has non-cross-link hyaluronic acid. The concentration is 6 milligrams per milliliter, right? With amino acids, vitamins, and what is more important, with ascorbic acid and with glutathione. So this means that glutathione and ascorbic acid will act in reducing pigmentation. The second product is called Cellbooster Lift, also with a concentration of 6 milligrams per milliliter, also with amino acids and vitamins for rejuvenation, lifting, and creating volume. This is a very good product, and I'll show afterwards different pictures, for scars, especially for acne scars. The third product is the Cellbooster, the fourth product, the Cellbooster Hair, which is also non-cross-link hyaluronic acid, 6 milligrams per milliliter, and it contains zinc and copper gluconate. Right, and the fourth product, the Cellbooster Shape, that contains vitamin C and carnitine. So why are all these products so interesting? This non-cross-link hyaluronic acid. As you know, hyaluronic acid as a molecule is a linear molecule made of uracanic acid and glucosamine. This is a sugar, basically, and these sugars contain many alcohol radicals. This means many free OHs, hydrogen and oxygen. And obviously, these hydrogen and oxygen are lost, and lots of different electrical charges are formed here. So hyaluronic acid has the capacity to grab water, because water is a polar molecule. Also, it is capable of attracting, as a very attractive molecule, different molecules like amino acids, glutathione, ascorbic acid, and these are attached in a physical way, as a marriage, let's say, right? And the way that the laboratory manufactures this is with high pressure. So this pressure makes all these compounds get together, join, and form this special complex and structure, which is very stable. This is the first product, Cellbooster Glow, and it contains 6 vials of 3 milliliters each. So when we study the composition of this hyaluronic acid, it says that it has 6 milligrams per milliliter. So when we study natural or naturally occurring hyaluronic acid, it will contain approximately 20 milligrams per milliliter, because up to 1 gram, all the rest of the weight is water. Hyaluronic acid is very good in attracting water. In this situation, with these products, hyaluronic acid is about 50% concentrated if you compare it with a filler. So this specific product, which is Cellbooster Glow, right, contains 2 essential substances, which is glutathione and vitamin C. How do they work? So glutathione is a very powerful antioxidant, and ascorbic acid is an inhibitor of the pathway we have to synthesize melanin. It also nourishes and revitalizes the skin because it contains amino acids, proline, lysine, and valine, which are very important in the synthesis of collagen. We know today that 1/3 of the molecule of collagen is made of hydroxyproline or hydroxylysine. Another third is glycine. It means that the composition of amino acids is like providing food or feeding the skin so that fibroblasts can take these amino acids and can produce more collagen. In theory, this should work. In reality, it has been proven once and again that if you provide glycine and lysine and proline to the skin, it synthesizes more collagen. So, when do we use Cellbooster Glow? We use it for hyperpigmentation, melasma, wrinkles, and dry skin. The program usually combines 3 treatments at the beginning, every 15 days, and then a support course of 1 treatment every month or every 2 months. What does glutathione do? Glutathione is the most powerful antioxidant of the body. It is a cofactor for several antioxidants, and it regenerates vitamin C and vitamin E. For example, the liver needs glutathione in order to transport different toxins out of the body. It is vital for mitochondria to maintain the DNA. So glutathione, though it might be not very well known, is a very simple molecule. It's made of just 3 amino acids, which is cysteine, glycine, and glutamic acid. And it's found in surprising high levels, about 5 millimolar, which is far higher than glucose or potassium or cholesterol. It's very important. So we know today, for example, that if you have very high levels of glutathione, your risk of diabetes comes down. It is also known that low levels of glutathione are associated with high risk of all-cause mortality. So it's very important to have glutathione in our body. It's one of the most important antioxidants. Beside that, it is used in melasma. And when I reviewed a recent paper about melasma, how do you treat it, right? You can see that among topical products, you use ascorbic acid, which is inhibiting the production of melanin, but also you have here orally, people take glutathione. We can also inject glutathione, because if you apply glutathione on top of the skin, don't think that you're going to have a lot of glutathione. It's going to be just 1% penetration. Whereas if you inject it, you obtain about 100 times the same concentration. So glutathione, and this is what this article was saying, proposing, is thought to act as an antioxidant that decreases inflammation, which is one key part of pigmentation. So it is both ascorbic acid and glutathione that interact with all the metabolism of producing melanin, both eumelanin or pheomelanin. If you review the effect of glutathione, right, you can see that there is an effect with different diseases. For example, with ovarian cancer, with creatinine, with the toxicity of different drugs, also with neurodegenerative diseases like Parkinson's, right? Glutathione has improved the disability of Parkinson people. And intravenous glutathione is used for skin lightening. This has been shown for many, many years now. And there is a significant reduction in melanin indices. You can see here a study from India, in Patna 2020, in 60 people, there was a reduction in the levels of melanin, right? You could also see here, right, in India, a study done in 15 individuals from 15 years old to 70, there was a decreased hyperpigmentation in 11 of the 15 patients. Watanabe in Japan studied glutathione in 30 female people, applying a 2% concentration as a lotion, right? It reduced significantly the melanin index. Here, Hamburg, Manila, 2015, 30 female were treated with 500 milligrams daily and observed a decreased melanin index. So glutathione is orally, topically, or injected, is very effective in reducing pigmentation. This is an example of a person that followed our treatment. This lady received just one session. She was 29 years old, and you can see a great improvement with just Cellbooster. This is another patient aged 35 with melasma, 2 sessions, one every 15 days. This was herself after 1 month, and also on the side with about a 50% reduction in the pigmentation. And here you can see an Afro-Spanish lady, right, 32 years old with melasma, after 6 sessions. This was 3 months later. And you can see a clear reduction of the melasma in the forehead, in the cheeks, and also around the face. This is the second product, Cellbooster Lift, probably my favorite. And you know why? Because I treat acne scarring with it. The Cellbooster Lift contains different vitamins, C, E, and biotin, which are important in antioxidation. It also contains these amino acids that are important, like arginine, glycine, lysine, proline, to the synthesis of collagen. So it is indicated in skin depressions, loss of firmness, dryness, skin laxity, and in scarring, in post-acne scars. And this is probably my favorite indication of all these products. What we do is several injections once every 2 or 3 weeks, and then supportive course of 1 treatment per 2 months. But in my case, I have treated ladies with aging. This is after 1 session, just 1 month later, and you can see also an improvement in the pigmentation and also in the wrinkles that look better. Well, most people ask, why should I trust this hyaluronic acid, which is not durable because it's not cross-linked? And how much does it last? It doesn't last for more. But as we know, and it's published in many, many, many articles, and I just grabbed one of it. This was published in the Archives of Dermatology in 2007. It talked and it studied how collagen would be produced because of cross-linked and non-cross-linked hyaluronic acid. So this is the hyaluronic acid. And as you can see here in red, you can see how the synthesis of procollagen has increased very strongly. Here you can see also, the type 1 procollagen, the N-terminal, and the prolyl 4 hydroxylase. So there is a huge increase in the synthesis of collagen. So when you inject hyaluronic acid in the scars of a patient, you can expect that for the following weeks and months, they are going to make new collagen in these places. This is the technique that we follow. So as you can see, the patient, right, is going to receive injections that we would like to treat in the dermis. These has to be very, very superficial injections. We don't want to inject under the dermis. So remember, the dermis is about 2 millimeters deep. So when you inject, you just put in the bevel, nothing else, and you inject there in the surface of the dermis, trying to break, just shut up this, trying to break all the bondages on the fibers of scars, and then inject the Cellbooster lift. The patient has topical anesthesia that has been applied for 10 or 15 minutes, and we do this procedure with just the bevel of the needle in all the scarring that we see. So what happens in patients that do 3 sessions, for example, is this, an amazing improvement. Or for example, this is after 4 sessions done every month. The same patient, a 27-year-old man. Here you have a 20-year-old man, again with an improvement of the scars. The same patient. And another one after 4 sessions. And you can see the flattening of the skin. The third product, the Cellbooster shape. This hyaluronic acid is combined with vitamin C and carnitine. So the idea is to destroy the fat. It comes in boxes of 6 vials, 3 milliliters each. And what you can do with it is, thanks to the L-carnitine and vitamin C, right, it contributes to the penetration of mitochondria and also to the burning of the long-chain fatty acids. This means that because metabolism is accelerated, you can burn your fat easily. So it normalizes all the metabolic processes, it stabilizes cell membranes, and it contributes to the normalization of skin salt-water balance. Vitamin C helps in oxidizing fat much better, right, with moderate exercise. So if you're doing exercise and you're taking at the same time vitamin C, you're going to see a much better improvement. The vials are composed of non-cross-linked hyaluronic acid at a concentration of 6 milligrams per milliliter, together with vitamin C and L-carnitine. This is the bottle, and it is indicated for cellulite, local fat accumulation, and double chin, cheeks, and eye bags. And this was probably the indication that I most like. So you do 3 treatments every 2 weeks, and a support course if you need it. So this is one person that received every 2 weeks 1 injection. This is after 4 sessions. And you can see how the bags have improved noticeably. The good thing of this is that you don't have bags with all the edema and all the swelling that cross-linked hyaluronic acid has. This is quite important. This is a very good advantage that I think are going to switch or swift the treatments of eye trough from cross-linked hyaluronic acid towards this, the Cellbooster shape. This is another patient after 4 sessions, also with an improvement in the backs. And here you see another person. And I think that there's not just the effect of destroying fat, but also a reduction in the wrinkling and the edema here. And last but not least, here we have the Cellbooster hair. So this is hyaluronic acid with vitamin B2, vitamin B6, and what is more important, niacin and copper gluconate and zinc. Zinc is a very good inhibitor of 5-alpha reductase, plus glycine and lysine and glutamide and cysteine are good in inducing new collagen. So as we know, the issue of hair is that its follicles have to interact with the dermis. They have to interact with the connective tissue, otherwise they're not going to grow properly. So we know that a good connective tissue, a healthy connective tissue, is going to stimulate the dermal papilla cells. And these cells are going to send messages to the cells in the promontorium. So growing of hair is not just about the hair, it's also about the communication between the dermis and the follicle. What is the activity of each? Zinc and biotin regulate the activity of sebaceous glands thanks to inhibiting the 5-alpha reductase. Niacin is an effective antioxidant, right, that blows away specific free radicals. Pantothenic acid prevents any hair graying, can restore the natural color. These amino acids are important, as I mentioned before, because they help in synthesizing new collagen. The indications are all types of alopecia, non-scarring alopecia, alopecia areata, and androgenetic alopecia. Also for seborrhea and psoriasis. I think that this can be a very good product if you can mix it with also finasteride, dutasteride, or minoxidil. The program is having treatments every 2 weeks. So what we do usually is have one session of one on day 0, another one on day 15, another one on day 30, and then we can have every month. This is an example of a 44-year-old man that had just 6 sessions of Cellbooster hair with an improvement in both the density and the hair shaft. So the Cellbooster is an intense mesotherapy due to the long duration of the hyaluronic acid, thanks to this special structure, this way of making it through compression. Second, thanks to this manufacture, we can have high concentration of active ingredients such as carnitine or vitamin C or glutathione. And this hyaluronic acid acts as a carrier of both water and all these active ingredients in order to induce all these effects. So thank you very much for your time. I'm going to open the section for questions and answer. Hello? Valerie, yes? Valeria?
Yes, hello. There is no, dear attendees, please ask your questions and answers in questions and answers section. So we will wait for a few minutes for you to type. If you want to ask some questions, please feel free to ask. Yeah, we have one question, I think.
Is there any questions that you would like to make, Valeria?
Thank you so much for your presentation. It was very detailed one. Maybe tell us a little bit more your experience with lift with acne scarring. Which type of patients do you prefer to treat? Do you notice the results for acne itself? So tell us a little bit more about this indication, because we found that you're particularly interested in this.
Okay, we have here four questions. The first one is, can we see please more before and after for hair? Okay, so this is very interesting because, as you know, there are several things for the hair, especially drugs such as dutasteride, minoxidil, etc. So the usual protocol I follow is not by using only the Cellbooster, right? Because we know that we need more things. But the Cellbooster can act as a medium because it maintains the concentration of these drugs for a longer period of time inside the skin. So when we have dutasteride and minoxidil and estrogens or progesterone, according to the type of alopecia, let's say that we have an effluvium telogenitin where we use progesterone, we mix it with the Cellbooster. So I haven't been able to show more pictures of the before and after with the hair because I always combine it with these things, okay? So the second question, how much do I charge for a full treatment session? So what we do, this is the example that I can give in both Madrid and Barcelona, is that we have a package of 6 for 800 and a package of 4 for 605. So it's quite affordable. It means that each session is going to cost in between 100 and 200 euros. Okay. A very interesting question by Hani Nama. Can we combine it with fractional CO2? Well, in fact, most people dislike injections. They think that injections, and this is true, are painful. And we apply anesthesia on top of the skin, but sometimes this is not enough. So we like a combination of erbium laser and the application of these Cellbooster. It works very well. And the way we use the erbium is by the fractional erbium. We use the fractional with 400 MTZ or 100 MTZ. So we go all over the surface of the skin, and then we apply the Cellbooster glow and the Cellbooster shape. What we don't do, we don't work in this way with the lift, because in the case of the lift, I need to inject directly into the dermis. There's another question here by Herr Padley. I wanted to know if you tried to inject lift deeply. Yes, I have, but that is more for regeneration of the hypodermis. So we have to bear in mind that the first 2 millimeters, and just the first 2 millimeters of the skin, are the dermis, which is full of collagen. It's a hard structure, and when you inject just the bevel of your needle, right, it's very hard to inject. But this is where we want our products. If you inject deeply, it is more for volume. And if you want volume, you have to work with cross-linked hyaluronic acid. Another question here. Can we mix the cocktails in the same session? Yes, I love mixing cocktails. In fact, it is the case of the hair. The hair requires, as I mentioned before, different medications. We know that dutasteride works, minoxidil works. There is evidence for finasteride. There is evidence for prostaglandins, for estrogens, and for progesterone. And we mix all that in the same session. Did you try to combine lift and glow in the same session? No. But what I combine is lasers and mesotherapy in the same session. So usually when I treat the scars of the acne, what I do is I inject the Cellbooster, the Cellbooster lift, and then I use the fractional CO2 or the fractional erbium. So the fractional erbium is flattening the surface, but the lift is doing the subcision and is breaking all the linkages that are underneath. Is there any other questions that I can reply for? Okay. There is another question here. Hani Naman, hello, how are you doing? Good evening. If we inject eye bags, there are no risk of lid edema, a small water retention with non-cross-link. Well, yes, this is the issue. When you inject the eye bags with the cross-link hyaluronic acid, there is usually with most of the product a big problem with edema. But there is no edema at all with Cellbooster. I don't know the exact reason. Maybe it's the quality, the purification of the product that really explains this. I sincerely think that these Cellbooster are a revolution. Well, it's very comfortable to work. To be honest, the first indication, the first use that I gave to this was the scarring. So as you know, scarring tissue is very hard. It's very difficult to inject. So I've tried for subcision, carboxytherapy, I've tried cross-linked hyaluronic acid of different types. I've tried many things, but it's really very difficult to go with your needle and go into the scarring. So I thought that this cell booster could work for me. And what I realized was that it lasts for a very long. The effect is very long. It doesn't go away. So patients don't come back in 1 month and say, at the beginning it was fine, but now I have my depression again. So it doesn't work like this. I don't know the exact reason, but there are many references in the literature describing how hyaluronic acid lasts for much longer than what we think. All right. There's another question here. What do you think about treating hair transplantation patients with Cellbooster hair? Okay. As we know, with hair transplantation, the follicles are transferred and they enter about 2 weeks later a stage of telogen. So we have to wait about 3 months until the hair follicles that have been transplanted grow back. So during that time, most people do nothing because they're basically surgeons that do the hair transplantation. But we know that the infiltrations with growth factors work very well. So we have tried, in fact, to combine PRP with Cellbooster, with minoxidil, and with dutasteride once every month in patients that have undergone hair transplantation. Apparently, the hair grows thicker and better, but not earlier. It takes about 3 months, and this is constant in the biology of the hairs. But I think it's a very good idea. There's another question here, Paddy. I never got any edema. This is true. This is a very important thing because I don't know you guys, but I'm really worried of having edema with hyaluronic acid. So one of the reasons why I'm moving to other different therapies like regenerative medicine, like exosomes, like PRP, is that when you inject, especially when you use hyaluronic acid, there's a huge swelling and edema. And in fact, every time I do an injection, I have to give my patients prednisone. The funny thing with Cellbooster is that you don't get the swelling. Sometimes when I run out of Cellbooster, I inject it in the scars of acne patients. I injected other cross-linked hyaluronic acid, and there was a lot of swelling. So it really happens. There is no swelling. Is anyone from the laboratory that can explain to us why this doesn't produce swelling?
Yes, because of stabilization. We stabilize the product and we integrate the smaller molecules inside the HA, and they are both stabilized during a stabilization process. So we're using special equipment to produce shear deformation and the pressure at the same time. That is why you don't have the hyaluronic acid doesn't attract water. And there is no swelling like this after injection. That's why it is a step-by-step release and a gradual release of the ingredients after injection.
Interesting. Is it all Swiss technology? Yeah, I think so. Okay. There's a question here. What is your experience on the neck? I haven't used it on the neck. I can't tell about this. I'm sorry. There's another question here. Thanks for the detailed presentation, but I missed the point. But what was the critical difference between lift and glow? So here we have hyaluronic acid, which is non-cross-linked, and you have 6 milligrams per milliliter. In nature, maybe in the eye, you have 20 milligrams. Here we have 6. And then the lift contains different amino acids in a very similar composition to collagen, like lysine, proline, glycine. but the glow has glutathione and vitamin C, ascorbic acid. So these two, what they promote basically is an antioxidation effect and also treating or the treatment of pigmentation. So that is the composition. About indications, I think that the indications are overlapped because you can very well use the glow in rejuvenation as well as in hyperpigmentation, whereas the lift might be only used for rejuvenation or for scarring. Can we mix the glow with PRP? Well, I've been mixing the hair with PRP. I must confess, I think that if you inject PRP and you can inject Cellbooster, you can inject both at the same time, and the stability is great. Next question, what would you say we can use Cellbooster together with Phyllis one session? Okay. I'm trying to think whether I've done this, and yes, in fact, a very interesting approach is, imagine that you want to provide volume to the cheeks or volume to the jawline, right? You use certain types of hyaluronic acid, cross-linked, but then you want to treat the eye trough. The eye trough has to be carefully treated. So instead of using that cross-linked hyaluronic acid, I use a different one, which is this one, Cellbooster. So I use it in the same session, but not in the same area. So here we have the 19 questions, right? And I think that we're done by now. I think that it's clear. It's on summary, I would tell you this is a very comfortable product because it never gives you any problem. It will never cause any patient to be swollen or to have different problems. I mean, in the case of the scars of the face, it is amazing how you do the treatment and the following day, patients do absolutely normal life, right? Whereas if you use other products, you might have some swelling. Also around the eye area, this is quite good and positive because it doesn't give this swelling or this accumulation. You know that sometimes when we treat the area of the bags, right, there's a lot of swelling, and sometimes you inject hyaluronic acid, you have some bubbles there. So it's not going to have that's not going to happen. There's another question on the tear troughs. Are you injecting deep in the tooth or more superficial? I inject quite deep, very deep, because probably the thickness of the skin there is one of the smallest. It's one of the thinnest layers of skin in the body. So injecting deep is very important to avoid causing any swelling. All right, Valeria, shall we end?
Thank you very much. Thank you very much, Doctor, for sharing your experience, very precious experience for us. We thank you for wonderful session, and yeah, we would like to welcome you next time to our series of webinar. Thank you so much, and have a good evening to everyone.
Okay, thank you very much for all of you for attending. And the webinars are easy and fast and all that. I hope that these can move to real life and on time meetings, right? Thank you very much also, Suisa, for all your cooperation and collaboration. Bye-bye.
Bye-bye for now. Thank you.